So hello everyone, my dear students, MDS aspirants and all the rankers of NEET MDS 2024 who are just about to begin with the MDS counseling process starting very soon. So this is a video on request of many of you. Thank you all for posting so many requests which make me more enlightened about finding more and more data relevant to the counseling. This is one topic I think many of you had visited my office, BDS to MDS office in last 1 month related to these queries. Every day, at least 50 to 70 calls, 100 plus messages asking the same very question, how to select a private dental college for your MDS branch. All those who have a rank maybe above 500, 600 or 700 and are like not you can say very likely to get a government seat, definitely opt for a private dental colleges, which are really good ones are there in India, so which can boost up your career by doing MDS in their institutes. What I want to say is, first thing I always start, although everyone was aiming, everyone was hoping, dreaming for a government seat, but just please do remember that doing MDS from a private college is not a crime. This is one thing. All those who have met me personally discussing this fact know this. You are not committing a crime, so don't be say sorry, don't be ashamed, don't be say less in confidence that you are entering a private college for MDS. There are many good colleges in India. Should not say this, but it's a fact. There are many colleges which are private and are better doing than the few government institutions. But rest all, any day, everyone hopes for the best. And I wish, I pray, and I believe you will end up getting the best college, best seat. So without wasting time on this, my suggestion to you all is just follow this sequence. Listen to this video maybe repeatedly again, but follow the sequence. Students message me, I have got this rank, say 1500, 2000, 3000, 4000, 10,000, whatever rank. Which college will should I take? Which college will I get? Which branch will I get? It does not start like that. We have to follow a flow chart. You all know how we teach, how I teach in my institute also. I try to put up in a sequence which you will remember for your life. So this sequence also will help you make a judicious decision. See, it is a decision once in a lifetime. So we will follow each and every step involved in this decision making so that you don't end up making wrong choices. As such, I will not allow you to do wrong choices. You can always contact me. There is a what Telegram group for counseling free of cost. Be aware of fraudsters asking money for counseling help. Join that group. We will help you out. Right? The link will be there in the chat of this. Just follow this sequence. The sequence starts with first thing, your budget. I know this is not a topic to be discussed in detail, but yes, this is the primary concern. Nobody is judging you. Nobody is going to ask you what is your budget. You just need to discuss this with your parents. It's actually not your budget, it's your parents' budget. See, not everybody can afford 20, 30 lakhs per annum, but yes, there are many who can afford that. So based on that, we always believe there is a segregation on economic strata. So nothing to be, you can say, uncomfortable on this. Let us be very practical. You have to decide upon a budget first. Like this much budget, say XYZ amount, your parents are ready to spend on your MDS per annum. Always calculate basis of per annum because the college will charge you fees on annual basis. Whatever is the budget, it has to include the college fees. It also has to include your hostel expense plus miscellaneous expense which colleges at times levy, like in the names of dental materials or some projects cost or something. Just read their website, read their prospectus very carefully and come to a certain figure. Say this figure is ABC, not XYZ now. This is one college has written my fees is say 7 lakhs, 10 lakhs per annum. But once you add hostel fees, mess fees, and then miscellaneous charges, it becomes say ABC. Whatever is the ABC value, just add 20 to 25%. Add 20 to 25% of ABC to it. Suppose the college is charging 10 lakhs per annum. Okay, just add 2 to 2.5 L more. That should be your budget per annum. 12.5 L in this case. Reason being, you need around 15 to 20,000 per month on multiple things which are not able to see right now. You may have to buy some equipments randomly, some instruments, some many like expense will go on your thesis preparation, maybe more, but this is the minimum value I am talking about. So first you decide your budget, discuss with your parents. In budget, I would like to stress upon all those who ask me, should we take loan or not? Actually, you don't take loan because you don't have any guarantee to fulfill it back. Your parents will take loan, that is called educational loan or whatever loan they get, and the interest starts from day one, but the payment starts after say 3.5 years from today. So what the situation is, I will not say the loan amount should not be more than say 1 year of fees. That is my personal experiences, because immediately after passing out, the jobs are not very lucrative and you will need 1 to 3 years of time to settle down after MDS. Then there is no looking back. I'll come to that point in another video, but just remember the loan should not be the entire 3 years of fees. It will end up in many troubles until unless you have a backup. See, in my life, in my personal experiences, I am a guy who always, like, people know me as a self-made person, right? But I'll tell you, my funda is today, if I want to take a loan, say I want to buy a car, new car worth 20 lakhs or 30 lakhs, I will not buy the car until unless I have 30 lakhs in my bank account. That is my own funda. That's what I want to tell you. Okay, you should have a backup, not ending up in trouble in such case scenario. So budget is done. Then your choice of states. What do you mean by choice of state? It's not everybody is keen on going in every state of the country. It's very subjective. I'm sorry to say, but this is the fact, right? Okay, it's not my opinion. This is based on my 18 years of discussion with lot many students every year who end up taking private colleges seats. A person sitting in Delhi may not want to go to say a college in Bihar or West Bengal or say Tamil Nadu or whatever, maybe of his or her own choices. It does not mean the colleges are bad there. Same way, a student in Chennai may not want to spend money and come all the way to UP dental colleges. That is a scenario I hope you all will agree upon. Usually students hop around in say around north, students you end up settling down in north, but yes, the best of colleges we all know are in South India, especially in Karnataka. We have Tamil Nadu, we have Kerala, good colleges we have. Everywhere, every state has good and bad colleges, I would say, in terms of private sector. So narrow down the states. Say you have shortlisted 2 or 3 states. Again, why this is important? Because you won't be able to attend all the state counseling because they all run simultaneously. And this year, the calendar what they have given is very problematic. Okay, it's going to be very, very rigid timelines and very close timelines. Though at times it get extended, they will have to extend it based on the pattern I have seen. But if you apply in multiple states, say you wish to apply in 5 or 10 states, firstly you will have to block money of counseling, which is 2 to 2.5 lakhs in every state. You will have to block, which is not a good cup of tea for everybody. Secondly, then you will have to, after the counseling results are out, you might get seat in all 5, and you have to choose which one you will go, which one you will not go. Round 1 or 2 is okay. Round 3 becomes a problem because your money gets forfeited. We have on our channel BDS to MDS all about counseling. Just type MCC counseling NEET MDS Amit Lall and you will see it in YouTube, that video. Okay, I'll share the link also in this video as well. So maximum you can say 2 or 3 states is more than enough. Shortlist the states. because you also know you will not end up choosing every state in India as your end up destination. So once you're shortlisted the states, okay, say 1 2 3, next task is very important and challenging. Say you have selected state number 1. I'm just giving you an example. Say you have selected state number 1 as Uttar Pradesh, that is UP. Just giving you an example, it's not about any predilection. Again, I'm repeating. If you have selected this state, next task is go to Google, type all dental colleges in Uttar Pradesh. Right? Say so you have 10, 20 dental colleges. I'm also not very sure of the number. Say you have 15 dental colleges. Just giving you an example. Visit website of each college and check out the fees per annum. Mostly they might have updated the latest fees. If they have not updated the fees shown is of previous year, just add 5 to 10% to it as an increase amount of inflation, right? Visit the website of all 15 and then say out of 15, 5 colleges or 7 colleges are in your budget. Coming back to the same point again, then these 7 colleges will be of your interest. Otherwise, they are not of your interest. I hope you are getting this point. That is the significance of finalizing the budget first, right? Right. Then how to shortlist colleges in a particular state. Once you have these 7 colleges which are according to your budget, next task is you rank them based on your survey, based on the inputs, based on your experiences, based on your visit and whatnot. You also know like these amongst these 7 colleges are good or bad, or like which is the priority order you have to decide upon. Then is filtering the colleges. It is with respect to the branches. Say I am interested in endo or prosto or OS, then out of those 7, which one is better in endo, which one is better in prosto, which one is better in OS? You have to make this list, right? I'll repeat. You start with your budget, discussing with your parents what is your annual budget finalized. Add 20 to 25% of contingency plan because that is an extra expense you need to keep in your pocket. Then choice of states, which states you are willing to go, which states you are not willing to go. Then shortlisting probable states. Once you have uh, selected probable states, say 3 states you have shortlisted or 2 you have shortlisted, visit each and every website of the colleges in that particular state and segregate them based on the budget. Then you narrow down, say all in all 7 colleges are in your favor, just for example. Then in those 7 colleges, which college you have surveyed or which you have feedback, which one is better, which one is not good. Okay. Then filter the colleges with respect to the MDS branches. You are willing to take endo or prosto, suppose, then these 7 colleges, which is better in endo, which is better in prosto, and so on. You start making one list, right? Then comes the most important part, how to finalize the best college suited to you for any particular branch. I have narrowed down my search to 7 colleges. I want to do, say, suppose endo. Okay, I have to make sure the endo I am going to take in out of these 7, I should end up taking the best out of 7 colleges. So how to rank them is number 1 criteria is the PG guide. I always tell my students who have got ranks, visit the colleges. If you have narrowed down, visit the colleges or talk to your seniors, talk to your anybody, take numbers from us, take numbers from your dear friends, enemies, whatever you do. But it should be a first hand information. If you ask me, say XYZ college is good or bad, my knowledge may be because of somebody else's information. It may also be incomplete or maybe incorrect as on today because I have reference say of 6 months back or maybe an year back review. So it's always better to take your own first-hand experience. If you have narrowed down, say 3, 4, 5 colleges, it's better to visit those colleges once before you end up taking any particular branch. The PG guide is the number one criteria how to select a private college. Say you have shortlisted, say 5 colleges, how to rank them. Number one criteria is PG guide. Suppose I want to do endo in that. Which college has got full-time guide will be a better one. Do not end up taking MDS seat in a college where you have part-time guides. You are going to spoil your own future. You will not end up learning anything. PG guide matters a lot for MDS. The guide should be full time, coming all 6 days in a week, 360 out of 365 days, only except on the holidays. He should be in the college. Secondly, the guide reputation. How many publications or how much research data, sorry, what all inputs he has brought, what all you can say evolution he has, the changes he has made in the department in last few years, you get to know once you talk to the PG students by taking a genuine feedback. Don't rely on people who are posting random colleges, promoting branches of random colleges, because they are nobody except the agents of those colleges. Colleges offer money in exchange of students, if you do not know. Okay, I have been offered this for last many years by many colleges. And I don't know whether you, all those who know me personally, they know we don't indulge in such practices. But I'm sorry to say, there are many people I know who are into teaching also of MD, MS, and MDS, and they are basically the agents of the private colleges. Okay, so be aware of them. If somebody tells you this college, this branch is very good, listen to that, accept the fact, but do your own Reiki, do your own research. Little bit of research you need to do on that before trusting anybody. If I tell you this college is good, I would even suggest take a genuine feedback by yourself. Do not trust me blindly on that, because my information might be little old and today the guide has changed, or maybe there is some other scenario. This much I am having conviction when I am saying to this to you, because I want you to be in a better place for a better future. Don't end up wasting your parents hard earned money into something, in you can say, who is giving you advice just for some 5%, 10% commission and nothing more than that, right? Then number one, PG guide, I hope you have understood. Next is OPD. Yes, the department should have more patients. Every day new patients, how many new patients always count. Plus the variety of cases, especially in the branches like oral surgery or ortho or prosto, you need to end up getting that. Recently, I got to know there is an old institution like KLE Belgaum, which was very, very good for MDS in like last a decade back. But today, the number of patients have fallen so badly, it is not at all a worthwhile place for doing MDS. That's my feedback, which I have got from students. Then another good college, like I don't know whether I should name or not, but another in Karnataka, another 2, 3 colleges which used to be really good, the guides are not full time. Okay, these are the genuine feedbacks you need to be aware of. The OPD matters, the variety of cases definitely matters. Overall, if you ask me, endo, usually every college has maximum OPD in endo or public health, because they are doing camps and all, and endo is because the patients, every next patient is bringing some pain to the platter, right? Third comes the infrastructure and the research options the college is promoting. Infrastructure does not mean only the building, it means the infrastructure of the department. Say endo should have more of microscopes nowadays, should have equipments which are latest. Prosto, there should be a dedicated implant center in the college. At least they are promoting new things. Maybe the implant center is not there today, but it is there in like in the pipeline coming in 3 to 6 months, then also it's pretty fine. I remember having a lecture in Kannur Dental College long back, just before COVID, and I was really happy to see they have a dedicated central clinic only for implants, and the word written, the company which had sponsored that was Noble Biocare, which is leading implant. Okay, Kannur Dental College in Kerala. Okay, likewise, many colleges nowadays have a centralized clinic only for implants. So these things matter, not the building, not the fountain, not the playground, not the auditorium. These are very secondary. The problem is our generation, first when we visit any college, we see the building, we see the campus, like Manipal, very famous for campus and all, but you know the harsh reality. Go visit there and you'll get to know, when you talk to PG students, the reality is something very upside down. Okay, so infrastructure, research options should be there. If the guide is good, he must be or she must be promoting a lot of research. So these things matter a lot, right? But the problem in today's scenario is we start with infrastructure, we see the building and we are happy, we see the little bit of OPD and we are happy, and we do not even know who is the guide, whether he is regular or irregular, and he or she, how, what is the reputation they carry forward. So taking genuine feedback from the PG students out there or the immediate pass outs are going to be the most vital source of information, even beyond this video. This video is based purely on the feedbacks, the reviews, the input from students of our institute in the previous years, and all those faculties and staff members I know in different colleges. It's not about segregating colleges into good, bad, or ugly. And this is a disclaimer for all those who may not be happy listening few names which I had mentioned. It's not at all biased and it's not at all related to them. So please don't start jumping and commenting immediately. Try and understand the whole purpose of this video is only one thing. You end up not wasting your money, you getting a best college, best price paid, and the best guide, working best environment, lot of patience, and taking full advantage of the research opportunities coming in the future. Thank you. May you get up getting the best seat of your choice as per your rank. All the best.